Hello, I'm Dr. Carolyn Coulam, Medical Director of FC Laboratories. I'm happy to be here to be able to share with you our enthusiasm about the workings of the laboratory. While this is a full-service laboratory, we have focused on the reproductive immunology, and this is important because most laboratories have not done this. Our interest is focused on the ability of humans to be able to implant an embryo and carry that embryo to term. The clinical aspects that we address are unexplained implantation failure and unexplained recurrent pregnancy loss. To answer the question why individuals would have difficulties having their desired family size, we look at the two components which are necessary for pregnancy to occur. The first is we need an embryo that is competent to implant and grow. And the second thing we need is an environment, that is the uterine environment, that allows an embryo to implant and grow. So when one has difficulties either implanting or growing an embryo, it can be for one of two major reasons. Either there's a problem with the embryo itself, it can't implant or grow, or alternatively, there's a problem within the uterine environment that's not allowing an otherwise normal embryo to implant and grow. If the problem is within the uterine cavity, the two major difficulties are either immunologic or thrombophilic. Because the embryo contains gene products contributed to by the mother and the father, we look at the mother's response to her own cells, looking for an autoimmune component, and her response to foreign cells, that is her husband's contribution, looking for an alloimmune component. The markers that we use to identify an autoimmune component include the following autoantibodies: antiphospholipid, antinuclear, antithyroid antibodies, and the so-called lupus-like anticoagulant. On the alloimmune side, we look at the mother's white blood cells, and specifically we're interested in a white blood cell subpopulation called natural killer cells. And we look at these natural killer cells in two ways. One, we look at the circulating levels of natural killer cells to make sure those are not elevated. And secondly, we look at the killing activity within each cell to make sure that's not elevated. And last, but certainly not least, we look to see if she has any circulating embryo toxins or anything that kills early embryos. And this is called an embryo toxicity assay. So those would be the immunologic risk factors that we would look at to see why a mother would not be able to either implant her embryo or grow her embryo properly. The next category within the environment involves her blood clotting genes or thrombophilic genes or thrombogenic risk factors. And these genes are from the mother, but also the same genes that we use for blood clotting, the embryo uses to actually invade in the lining of the uterus. And so we need to look at the genes from the father as well. And these blood clotting genes are involved in the clotting of blood, of the dissolution of that clot called fibrinogenesis. And this is called the thrombophilia panel.